Hey guys, it's Leah from Prestige Worldwide. I wanted to come on today and just give you a few tips and talk about things that I look at when I'm looking at medical records, right? Help you understand what everything means in your medical records, not everything, but give you a good understanding of what the VA might look at, what I'm looking at, what's important to you, and helping you decipher some of that, right? So whether it's the VA writing your VA's medical records, your civilian medical records, your service treatment records, whether the records are done in this country or another country, there's generally a standard way that medical records are written, right? So generally the first portion is going to be called the chief complaint, right? So that's going to be the reason why you came in for that day. So knee pain, a cold, a cough, whatever it is. The next portion you're going to notice is probably where the nurse is going to chart things like your allergies, your vital signs, like your blood pressure, your pulse, things like that. They're going to chart what medications you're on, just basically like kind of your history, right? Just in general, your surgical history that might be relevant, things like that. The next portion is called the subjective portion, right? And so that's going to be your complaints that are specifically for that day, right? So you're coming in for your knee pain, let's say. So you're going to talk about, they're going to chart about when did it start, or when was the onset, what provokes it, right? Walking, maybe you're just sitting and it hurts, maybe running hurts it, things like that. They're going to talk about, does it radiate? If you've got back pain, are you having radiating symptoms down your legs? Okay. Do you have, the severity on a scale of 1 to 10? How bad is that pain, right? And then the timing, right? So when did it start? Did it start last week? Did it start months ago, etc.? Right? So just a very detailed history about that specific complaint that you're coming in for that day, right? So underneath that, generally, in the medical note is going to be the objective findings, or the findings that the doctor is going to chart about. So what does your knee look like, right? Is there bruising? Is there swelling? Is there fluid on your knee? Is there a laceration or a cut on your knee? Anything that they observe or see is what they're going to chart in that section, right? If they watch you walk, does it look like you're walking with a limp? Things like that. Perhaps they're going to say you don't have a limp, and they're going to chart that in that section, right? The next portion is any special tests that they do, right? Anything that's like those fancy tests that they do for your knee to look for crepitus or cracking or anything like that. They're going to chart in that section. The next section is one of the most important sections to your VA disability claim and to, what I look for when I'm looking through your records. That's the assessment or the diagnosis section. So you may complain of, for example, IBS in the top portion and give a history. Hey, I think I have IBS, right? But that doesn't matter so much as what the provider thinks, what their diagnosis is going to be. So in the assessment portion, that is where the doctor is going to put a specific diagnosis that's usually related to something called an ICD-10 code, right? It's just a specific code that they put for knee pain, IBS, back pain, whatever it is. But that assessment portion is what the most important kind of part of what I look for when I'm looking for conditions that could be service-connected, right? Many veterans I know will say, well, I complained about this and that. Well, what you're complaining about is very important, right? You could be complaining about headaches, you could be complaining about whatever, but what's really kind of one of the more important things is, what is that physician diagnosing you with, right? Because they're the one with a medical degree or a license that can determine what they think your symptoms are attributed to, right? And so that's what the VA looks for. That's what I look for. Not to say that that all the portions aren't important, but that assessment portion, that diagnosis portion is what typically we're looking for, right? And underneath that is something called the plan, right? And that's usually where they're going to talk about, we're going to prescribe Motrin, we're going to prescribe this drug, we're going to prescribe physical therapy, things like that, right? And so that in a nutshell is what a medical note looks like, like I said. So we actually use an acronym called SOAP, right? So the subjective portion, or your complaint of that condition, the objective portion, the O, right? That's what we see, right? The assessment, right? Or the diagnosis, and then the plan. So that's what we're looking for when I'm looking at your notes. I look at the dates. I look at how long things have been. You know, if you complained about something in 1976 and haven't been seen for it since, that might be a little problematic, right? But we look at things like that. And so I hope that was helpful in letting you guys know and helping educate you on how to read a medical note, okay? So I'm going to work on a couple more tips for the week, and hopefully we'll get you guys some more good information, and we'll talk to you soon. Thanks.